answer a question while retaining the floor. I'm going to continue with a little bit more here before we change topics for the night. I want to point out how grateful I am for my friend Chris Murphy. The last time I stood on this floor for many hours was just in support, doing like my colleague is doing for me right now. After the Pulse shooting, we wanted a vote on common sense gun safety. Bipartisan supported common sense gun safety. We didn't get it. Chris Murphy, right down there, held the floor for 15 hours. And I paced around, walked the floor, helped to support things, stayed up with him all night. And it is profound to me that when I told my brother that I wanted to cause some good trouble, that I was going to rise, that he said, I'm in. And so there he is helping me out, especially as we approach 11 o'clock at night. And the fourth hour, I'm just grateful for him. I'm grateful for him. I want to go now to cuts that are being made to local and state health department funding. And again, Republican and Democratic governors, we have letters from people on both sides of the aisle who are saying that this is just wrong. And it makes no sense, but here we go. It's actually a really, what I would call a dangerous reversal that Trump's HH&S recently announced the cancellation of almost $12 billion in federal grants that state and local health departments have been using to track infectious diseases, health disparities, vaccinations, mental health, substance use, and services. Because of that reversal, my state, for example, is going to lose $350 million in federal funding for health programs due to these cuts. My governor, Phil Murphy, said that these cuts would create an unfillable void in funding that will have disastrous ramifications for our most vulnerable neighbors. Last week, we learned that HH&S planned to cut an additional 10,000 jobs. In total, since January, HH&S has cut 20,000 of its employees. That's over a quarter of its workforce. These are people who inspect nursing homes to ensure that they're safe. They improve diagnostic and treatment services for children, regulate health insurance to make sure that they are not discriminating against you based on your health conditions and health status, to protect you from infectious diseases, conduct inspections to make sure that infant formula is safe. And I want to tell you that Secretary Kennedy has committed to bringing radical transparency to the HH&S. I would love radical transparency. But at the end of February, Secretary Kennedy announced that HH&S is no longer required to undergo the public comment period, a practice that's taken place at the agency since 1971. Another critical resource of health information for the American public is the CDC's Morbidity and Mortality Weekly Report. That has been published since 1952 and is often called the voice of the CDC. But unfortunately, on January 23rd, the first time since its inception, the report was not published in a direct response to the Trump administration's freeze on public communications. In addition to pausing the critical publication, it also reported that the Pregnancy Risk Assessment Monitoring System had halted operation. This PRAMS, which was developed in 1987, is designed to identify groups of women and infants at high risk for health problems, to monitor changes in health status, and to measure progress towards goals in improving the health of mothers and infants. Over the last 38 years, the program has collected essential data on maternal behaviors and experiences before, during, and shortly after pregnancy. Maternal care providers rely on that data collected by PRAMS, the sole source of this type of information, to enhance prenatal and postnatal care. The U.S. is in the midst of a mortality crisis, which we mentioned before. We have the highest rate of maternal deaths of any high-income nation. As I learned when I was a mayor, data is power. You can't manage a problem unless you have measures on the problem. To pull back things like that, again, you're reducing transparency, you're cutting back on vital reports that people who are trying to meet this crisis rely on to inform their strategies. And again, here's the frustration, is that as we are the worst in maternal health outcomes for developed nations, but even in our country, African American women are 3 times more likely to die from pregnancy-related causes than the majority. This is one of the countries where it's profoundly dangerous to have kids. And again, this is yet another thing that HHS is doing that's leaving us more vulnerable, less informed, less empowered to deal with the health challenges that we still deal with. Since the Trump administration made the disastrous decision for agencies to pause external communications, we've been seeing significant delays in critical information from other key agencies. There have been avoidable delays in critical data from the CDC that states are starting to speak out, saying that they need to protect the health of their communities. As of March 20th, when it comes to vaccines, what we're seeing in America, talk about getting less safe, there are 378 confirmed cases of measles throughout the United States. As one of my doctor friends said, there are more children with measles right now than there are trans athletes in the NCAA. This is a real crisis. For the first time in a decade, a child who was not vaccinated for measles tragically died in that outbreak. And while measles is spreading across our nation, and we're having one of the worst flu seasons in the last decades, HHS has delayed the convening of critical advisory councils at the CDC and FDA. These advisory councils are responsible for determining the vaccine schedule, what vaccines must be covered by insurance, and the safety, effectiveness, and appropriate use of vaccines. They do essential and timely work to keep people safe, and disruptions to their work can be harmful to the health of the American people. Let me go to the National Institute of Health. It's the largest public funder of biomedical research in the world. It's facing devastating cuts. The NIH is one of the greatest successes in publicly funded scientific research in all of human history. The US is one of the best places to do scientific research because it has had more capacity than any other country to fund and conduct research at the highest levels. Pauses, lapses, and elimination of NIH funding will drive researchers to do their research in other countries and undermine the efforts to cure diseases, to find solutions to conditions, from obesity to Alzheimer's to cancers. One of the best taxpayer dollars we can invest is in NIH because it returns more than 5 taxpayers' dollars back in the breakthroughs that they make. We have put the future of scientific research in the United States at grave threats with what the Trump administration is now doing. They've imposed cuts and a number of harmful orders on the NIH that have both stalled its research and confused its partners. 99.4% of the FDA-approved drugs come from the NIH-funded research. Let me just say that again. NIH-funded research has led to 99.4% of all the FDA drugs that are out there. The NIH funding cuts will directly affect your access to future novel treatments that can improve your quality of life or your children, or if you love your neighbor, like so many religions call us to do, with your neighbor's children as well. Here's an example of that. Hepatitis C is a liver disease caused by the virus HCV, and it is one of the most common types of viral hepatitis in the United States. It is estimated that 3 to 4 million Americans have hepatitis. In 2014, the first complete treatment for hepatitis C was approved by the FDA. The development of this revolutionary new treatment that has since been used to cure millions of people around the world was funded by, NIH research. This is a type of life-saving innovation we will lose out on if we defund the NIH as the Trump administration is currently doing. American enterprise and knowledge will be drained. We will fall behind. We already know there's fierce competition for the researchers by countries like China. They are aiming, in fact, they are upping their investments in scientific research, doing everything they can to keep scientific researchers in their country. I was just talking to an innovator out in the West Coast who was telling me that they're starting to take passports away from their researchers. There's a fierce competition going on to keep the best minds here in this country or be drawn away to other places from Europe to China, and we're stopping our funding? I've heard from academic institutions that are telling me that they're not even offering as many PhD programs in some of these key areas of science because of the attacks that are happening on our universities, all while China is upping their investments in the universities. I can't believe that they're trying to out-America us, and we're trying to turn our back on our most successful traditions. One of his first actions, President Trump imposed a communications freeze on all U.S. health agencies, effectively silencing some of our nation's top researchers, scientists, and public health experts. This action stalled 16,000 grant applications for around $1.5 billion in NIH funding. The NIH has since begun to incrementally send notices to the Office of the Federal Register to resume reviews. The combination of these actions irresponsibly have stalled our nation's primary source of life-saving biomedical research. It is our understanding that full communications have not been resumed and that it continues to impede critical research at the NIH. As I've been told time and time again by experts in this area, just to pause funding could set research back years. Because when you're conducting research, whether it's in a test tube, in biomedical research, you can't pause. Whether it's in a human body, in biomedical research, you can't pause. Across the nation, brilliant researchers have been finding out daily that the Trump administration has canceled their research. Research on critical issues like maternal health, long COVID, diabetes, new pharmaceutical drugs, cancer, and so much more. The NIH has decided to cancel its 2025 summer internship program. On average, 1,100 interns participate in this program each year, helping develop the next generation of scientists and researchers. A small number of summer interns had already been accepted their offer to join the NIH in 2025. The decision follows the Trump administration's federal hiring freeze. Again, in my faith, there's a saying, train a child in the way he shall go, and he will not depart from it. These are our young people. These are the future scientists now aren't getting the experience of the lifetime. I've met people in this institution who first came here as college summer interns. The NIH has decided not only to cancel those internships, but to shut the door to many kids who had already made their summer plans. Many people here know what it's like to have a summer plan, have a summer internship, not apply for other ones. It's another act of just meanness and cruelty. Let this class come in and then say, okay, I'm going to cut the program next year, but the way they're doing things is mean and cruel and having an impact on people's lives. Congressionally directed medical research programs. I've worked across the aisle with my colleagues. I have friends in here that have worked with me on specific diseases in a bipartisan way. I'm so proud of some of that work. Well, we've long appropriated about $1.5 billion a year in federal funds for medical research, nearly half of which typically goes to cancer. It's something that we have found common ground on in my 12 years here in significant stretches. The medical research program was created and sustained by Congress, competitively awards funds to hundreds of projects each year at both the Defense Department labs and outside research institutions, including at many American universities, to study everything again from cancer to battlefield wounds to suicide prevention. In 2024, $130 million was specifically appropriated in a bipartisan way in this body incredibly good senators of good conscience coming together and saying we should do more in these areas. They approved $130 million for research in breast, kidney, lung, melanoma, ovarian, pancreatic, prostate, and a handful of very rare cancers. Why? Because they're people of good conscience here. We meet folks who come to this, they're not lobbyists, they come and they tell us about their stories of rare cancers. There are people on both sides of the aisle that have marched for prostate awareness, for breast cancer awareness. There's a goodness and decency here, but in 2024, this funding, it's a bill that passed in March. It was now slashed by 57%. And I told you earlier that data, one of the best taxpayer dollars we can spend is in medical research. We've all heard this in this body when the NIH has come through and shown a dollar invested could get more than $5 back. Any Wall Street executive that would get 5 times their money back from an investment, who is this helping? And do we think about the people? I thank God I don't have many family members that are going about your day, go to the doctor, come back with a cancer. I know lots of people, though. I know their stories. When they're diagnosed with a cancer and they're told there's no cure, I've seen people go through what you go through in that. And so, how could the country that has led humanity for more than a generation or two suddenly have a president come along and say, I'm going to slash all of these things, and oh, by the way, I'm going to give billionaires a big tax cut? So what do we say when these folks come to our office? Some of the people with rare diseases came to my office a couple weeks ago. And the amount of their funding is so small. And maybe if it was to solve our budget deficit, if we're going to do this as a country, we got to come together in a bipartisan way. The debt is I'm one of these Democrats that believes it's a real crisis. But we are not solving the deficit in what they're proposing here. They're cutting and cutting and cutting things that make no sense to cut. And they're doing it for tax breaks which disproportionately go to the wealthiest and to rack up even more debt. I want to read this article, and my staff told me we have lots of sections to go through, and it's been 4 hours and 11 minutes. But this is one that hurts me because I've met so many people who fall into this category. I want to read an article that deals with an issue called medical debt and the ongoing impact it has on people as part of their lives. The Affordable Care Act, when we did that, we lowered the costs and implemented protections for Americans, requiring insurers to cover pre-existing conditions, expanding Medicaid, which we've talked about a lot tonight, implementing caps on out-of-pocket costs for Americans. All of these helped in alleviating medical bankruptcy for some. Medical bankruptcies in America have gone down, but not all. We still live in a country where one of the top reasons for bankruptcy is medical debt. One of my staffers kind of shook me with the reality she was dealing with, which is she's got stratospheric medical debt. So here's an article from Healthcare Insights. It's not a partisan rag, it's a scientific journal. How medical debt is crushing 100 million Americans. It's from October of last year. This author, I just want to give a little more understanding of what kind of article this is. It's John August. He is the Scheinman Institute's Director of Healthcare. George Curley is one of 52 million people, or 1/3 of Americans in the workforce, who earn $15 an hour or less. I had the opportunity to interview George recently about his experience with medical debt and how it has impacted his life. Having suffered an industrial accident, and even though his employer was responsible for his injuries, and he carried health insurance, he still accumulated $20,000 in medical debt. George grew up in Dallas and spent his life working hard as a full-time warehouse and retail worker. At one point in his life, he found a job, and he enjoyed working as a forklift driver in a factory that produced ceramic tile. In time, he switched jobs, working on the production line. One fateful day, a piece of metal struck him in the foot. He had to have surgery and underwent the amputation of one of his toes. He had to take a month off from work, and when he returned, he went back to driving the forklift. He found that due to his accident and surgery, he couldn't operate the forklift to his satisfaction. He became frustrated, and not being able to operate the forklift, he grew depressed and left the job. It took me 3 months to get back on my feet after the toe amputation. There were nursing care for 2 months to help me work again. This life-saving medical procedure left me with over $20,000 in debt, even with insurance, ! I avoided doing necessary follow-up with doctors due to not being able to afford additional care. There were hard times on top of this. I suffered a great deal of depression due to losing my job during my leave of absence. This medical debt is currently following me. There was a point of time that I was rebuilding my credit. Before the surgery, I built it up by over 120 points. With the medical debt on my credit report, my credit score dropped 60 points. The big drop in score has not allowed me to get my own place. I'm not able to continue to pursue my dream of being a voice actor due to not having proper financial footing to get back to school. I can travel and do things I would like to do. I can't travel and do things I'd like to do. I'm working, but things are very financially tight. The medicine I need is being paid out of pocket. After paying my bills, I'm in the negative. There is no money left over to pay my medical debt. I can't save money right now, not even towards retirement. To have this medical debt on my credit score means not being able to pursue a better life. He went on short-term disability for a while, but then found the part-time job he holds now at Walgreens. He had to return to work to pay for the house he and his brothers had purchased. Through this period, George had to take payday loans, and between those loans and his weekly wages, he attempted to pay back the money he owed the hospitals. He learned that because of his medical debt, his credit rating was destroyed by credit agencies who learned that he had fallen behind on his payments to the hospitals. According to the Consumer Finance Protection Bureau, which I guess barely exists now, 100 million Americans owe $220 billion in medical debt. 100 million Americans owe $220 billion in medical debt. George told me that the medical debt has had several devastating impacts on his life: inability to borrow money for a mortgage or a car. Employees ask for credit reports, and reports that show an applicant for a position are often rejected to a poor credit report. This has impacted his ability to find a better job than his part-time job at $15 an hour with no benefits, working at Walgreens, where he lives in Garland, Texas. Incredible stress that further impacts his health conditions, including diabetes. An additional note, Garland, Texas, where George lives, is near Dallas, which includes Garland and Dallas is a locality with high medical debt and high profit for healthcare systems in the region. Though George makes very low wages, medical debt is a broadly shared experience by Americans across income groups. Clearly, low-wage workers suffer the worst burden, but the problem is pervasive and a broad feature of American life. Some background. In the oft-cited study, as many as 65.5% of people who file for bankruptcy blame medical bills as a primary cause. I'm going to repeat that in the article. 66.5% of Americans who file for bankruptcy blame medical bills as their primary cause. 2/3 of Americans who are filing bankruptcy point to medical bills as the cause. As many as 550,000 people file for bankruptcy every year for this reason. More than 500,000 Americans, year after year after year after year after year after year, for no fault of their own, because of a metal bar shoved up through his toe, because of a diagnosis of cancer, because of diabetes, because of things outside of their control, they rack up medical debt that, as this man, can erode their well-being. This data has been known about how many Americans affected and has continued even with the passage of the Affordable Care Act. Lesser known is the amount of medical debt that Americans carry. What are the causes of this burden on so many? While more Americans have health insurance today than ever before, coverage has many gaps. High deductibles and narrow networks, which prevent patients from seeking health providers of their choice, and common cause of accumulation of high-cost bills. When patients understandably seek care from a preferred provider, too often that care is not covered. Most healthcare plans only provide 80% of payment for covered costs. 20% patient responsibility of high medical bills can leave people unable to pay their bills. Approximately 14 million people in America, 6% of adults in the U.S. owe over $1,000 in medical debt, and about 3 million people, 1% of Americans, owe medical debt of more than 10 grand. Additionally, this government report identifies many of the components of medical debt which are completely out of control of the patient. In most cases, these practices are unlawful, but hospitals use these tactics frequently to press patients to pay, including double billing. Companies can not attempt to collect on medical bills that have already been paid by the consumer insurance or a government program such as Medicaid or Medicaid. This practice can coerce consumers into paying twice for the same service. Expanding legal limits. Companies must not attempt to collect amounts that surpass federal or state caps, such as those set by the Federal No Surpass Act or state laws on reasonable rates. These violations can saddle consumers with unjustly high medical debts, burdening their finances. Falsified or fake charges. Debt collectors must not collect on bills that include upcoded or exaggerated services or charges that service the consumer did not receive. Collecting unsubstantiated medical debts. Debt collectors must not attempt to collect medical debts. These are all awful practices that go on. Here's Paul Sugar's story, compelling and tragic. Paul spent much of his life, starting as a child, as learning about jewelry, living in a small town near Albuquerque, New Mexico. At an early age, he earned enough money selling silver and turquoise necklaces to be able to buy a motorcycle. As he became an adult, he developed a successful business in the mining and selling of silver and turquoise used in making jewelry. He also worked at GE, the GE engine plant, but was laid off during the time of industrial downsizing. He went to work for Quest, installing communications infrastructure, but was laid off from that job when Quest was acquired by US West. So he returned to his business. On January 9th, 2019, he was terribly injured in a fire at his home. He is still recovering physically and economically after losing 66% of his skin and getting care at a specialty trauma unit in another part of the country. He ended up owing over $82,000 in medical bills. The medical debt on his credit report means he has not been able to get loans to expand his business and earn more after the fire. His medical bills totaled $550,000. Insurance covered most of it, but it was still more than he could pay. He made payment plans with all of his various bills, but when his credit card number changed, some of the automatic payments he had arranged for did not go through, and the bills ended up in collection before he even knew he was behind. Prior to the fire, he always had stellar credit rating, but since this medical debt it has gone down. It's in his business, it's important to be able to take out short-term loans to supply the company, but now he can't do that at reasonable terms and rates. He spent his retirement savings account trying to pay back all of his medical bills, his retirement savings, but it wasn't enough. Now he worries about his future. How will he retire? Will he have enough for his daughter's college education? Can he move homes if he needs to? At one point, he needed to replace his car because he and his wife had to travel 18 hours round trips every couple of weeks to receive prescriptions for pain medication. He was denied the credit to do so. Our healthcare professionals are on the front lines of the impact of medical debt. Doctors and other healthcare professionals experience firsthand when patients are denied care due to medical debt. This article describes how healthcare systems deny patients with medical debt. Dr. Matt Hoffman, who was a leader in the successful effort to form a union with Doctors' Council in 2023, talked about this problem. They instructed staff to stop providing care to patients with more than $4,500 in overdue bills, going beyond the more common practice of turning such debts over to collection agencies. He and his fellow doctors protested their healthcare system's decision to deny patients access to care due to medical debt. Minnesota Attorney General Keith Ellison banned the denial of care for patients with medical debt. I mean, these practices sound like they're Byzantine. They don't sound like America, or at least who we should be. There's a lot of New Jerseyans who are dealing with medical debt. There are a lot of New Jerseyans that are being impacted by these programs that the president has already rolled back. I'm standing today because of this crisis in our country, and one of the strategies that Donald Trump and his team have talked about is to flood the zone, flood the zone, flood the zone. And so sometimes the press doesn't even cover the cutting of some of these programs, some of these benefits that help people who are struggling with medical debt or struggling making ends meet, help them access health care. It's a level of distraction and cruelty. And again, why? Why are they cutting this? They're saying they're trying to make government more efficient or more effective. Well, it's not effective for these folks. And what are the savings going to go to? Is it going to go to expanding medical research, expanding those things that when taxpayers invest money on, they get returned? No, they're cutting medical research. They're cutting the things that empower children to grow up and have healthy, productive lives. And again, what they're aiming to do with it is to provide massive, massive tax cuts. I'm coming to the end of this section, but there are more voices that I want to include. I'm going to read a few, and then I think I'm going to get a question from my colleague. So a few more pages, if I may, before we begin. It's a dialogue, or at least I'll receive a question, I imagine. But I just want to elevate some of these voices. This is a person writing to me in February 28th. Dear Senator Booker, I'm writing to you as a concerned citizen and most importantly as a proud aunt of a PhD in neuroscience, dedicating her life to research that could lead to life-saving treatments. As a minority in science, she has worked incredibly hard to break barriers in a field that is not always welcome to people like her. Watching the current political attacks on research funding is not just heartbreaking, it's dangerous for our country's future. Science is not political. It serves all people, regardless of race, background, or party affiliation. Yes, funding cuts to agencies like NIH and the National Science Foundation threaten to halt critical research, slowing the development of treatment for diseases that impact millions. These cuts will push out brilliant young scientists, many of whom have already had to fight to get where they are to do the research they're doing. This is not just about my niece or scientists in general. It's about every American. Disease does not choose a political party. Cancer, Alzheimer's, Parkinson's, and countless others affect Republicans and Democrats alike. Without strong investment in research, we are all at risk of losing the chance for better treatments, new cures, and improved health care. Beyond health funding, science will hurt our economy Scientific research drives innovation, creates jobs, and ensures that the U.S. remains a global leader. A country that does not invest in science is a country that falls behind. I urge you to continue standing with the scientific community, supporting young researchers from all backgrounds, and fighting to protect and expand research funding. This is one of the most critical investments we can make for health, for economic growth, and for the future of every American. Thank you for your time, leadership, and dedication to building a stronger, smarter, and healthier nation. A couple New Jersey sources. At my university, this is a letter from someone in Somerset, New Jersey. At my university, I am extremely concerned that we are not as large an institution as some of the others and do not get as much state aid. We rely on these funds far more than running facilities. If this goes into effect, it will ultimately lead to the loss of jobs, research, opportunities for students, and will stunt our growth as we embark on a journey to become an R1 institution. I'm not sure we could recover from this anytime soon. Another person on these cuts to the NIH. I'm a postdoctoral researcher performing basic science research on bacterial communication. In short, I'm seeking to understand bacterial chemical communication to find new pathways for therapeutic development. Antibiotic research resistance is already killing thousands of Americans each year. We need new treatments provided by indirect costs to find these cures. Indirect costs actually directly funded my day-to-day work, providing funds for building maintenance staff, university-shared resources such as electron microscopes, and common laboratory supplies such as liquid nitrogen. Without any of these resources, my job and those of others researchers seeking new cures would be impossible. Thus, eliminating or reducing these funds will have a negative repercussions on the health and well-being of the American people for generations to come. It's my constituent from Plainsboro, New Jersey. Related to federal grant funding freezes, another New Jerseyan writes, I'm a researcher at a university in New Jersey where I study ways to combat cancer and promote infant health, critical research that ensures generations grow into healthy adults. My aspirations align with yours, fostering a strong, healthy, and educated population. For this reason, I urge you, Cory Booker, to take immediate action to restore normal federal grant operations so that my colleagues and I can continue making paradigm-shifting, state-of-the-art discoveries with the potential to save millions of lives. This university is dependent upon federal grants, a testament to the world-class quality of our research and its leadership in the biomedical field. These grants enable groundbreaking advancements that position the United States at the forefront of scientific information. I had planned to apply for a federal grant in 2025 to further my research. But with the current uncertainty, I'm deeply concerned about my application's future. Here's another scientist. My 5-year NIH grant is in its second year, and although my first year budget ended and I submitted all the required documents, my second year funding was cut. We need the funding to be able to continue our critical research. Here's another patient story. At age 17, a large black spot blocking his vision suddenly appeared in my patient's right eye. Over the next couple of months, multiple trips to increasingly specialized doctors led to a clinical diagnosis of von Hippel-Lindau disease. The diagnosis received by phone on his 18th birthday. This is a genetic disease in which the damaged VHL tumor suppressor gene fails to stop tumors from growing. Patients experience randomly occurring tumors in up to 10 organs. And the only available treatment was surgery to try to remove the tumors. The patient is one of about 10% of patients who are de novo, the result of random genetic mutation. In this patient's case, scans had revealed not only a large tumor on the optic nerve of his right eye, but also a huge tumor encompassing one of his adrenal glands that, in retrospect, had been causing him headaches, inability to concentrate, and anxiety due to consistently elevated adrenal levels, while MRI scans also related tumors in his spine, kidney, and pancreas. This tumor and entire adrenal gland needed to be removed. After months of injections, his eye interspersed with laser treatment, he lost the vision in his right eye. The time needed for medical care required us to give him to give up his team sport, losing both a support group and the chance to compete at the Division I level, but he continued with his final exams, graduation, and plans to study engineering at the university. With continued regular monitoring, he was able to attend university, but the trauma of his diagnosis and the processing of the impact of what it might mean for his life, coupled with the stress of engineering studies, brought on significant mental health challenges. He did go on to graduate, traveling to the NIH for his regular surveillance, supported by various specialists. In 2022, a kidney tumor had grown large enough that he needed surgery again. The kidney is a sensitive organ and will normally have full nephrectomy of the affected kidney. Doctors were treating him. And now at age 24, his tumor was removed in a successful kidney-sparing robotic operation. Yet tumors on his spine continue to grow. This experience of my patient and many others encapsulates the miracle of medical research funding that has such a powerful impact on people's lives. We were able to get seriously miraculous things done. But without funding for these diseases, we may never have a chance to test the ideas and develop them in a way that led to a drug that ultimately helped this patient with these tumors. This is a success story, but will we have more? Will we have others? The drug we developed is expensive. Current recommendations are to take it daily. Nothing is known about its long-term side effects. More research is done. It's not known whether patients can take breaks from the drug. Stopping at some point might mean tumors would resume. One of the congressionally directed medical research program grants recommended for FY25 funding is going to look precisely at many of these questions. 2 others will examine other aspects of critical treatment. These are life or death issues for the patients. And yet this funding now is threatened. Yet this research now is threatened. Please continue to fully fund the congressionally directed medical program. I'm going to read a few more and then pause, just in case my colleague wants to ask a question. But this is Carrie Muller from Texas. My family has benefited from congressionally directed medical research programs because my 13-year-old daughters have neurofibromatosis, a rare genetic disease which causes uncontrolled tumor growth. My daughter Caitlin was diagnosed with a brain tumor 2 years ago, and thanks to a drug whose research was seeded with congressionally directed medical research program, her brain tumor has decreased to the point that it is now undetectable on an MRI. Without this drug, she would have had to try other chemotherapy treatments that would have been more invasive, in addition to brain surgery to bypass a blockage the tumor would have caused. This is Samantha Pearson from Las Vegas. For just over 4 years, I've been on a clinical trial at UCLA. The meds were just recently FDA approved. While the side effects sometimes made me question agreeing to the trial, being told my tumors have drastically shrunk made it all worthwhile. My pain has decreased. My plexiform neurofibroma is 90% smaller, and I am so happy that I get to be a part of this clinical trial made possibly by NFRP because of my participation in the drug trial. There is story after story here of people, Camille Olenberg, Jan Domowski, Lola Neudecker, Professor Alexander Robachevsky, Kyle Retz, Carissa Heberkamp from Illinois, Samuel Curtin, Dr. Stephanie Bucks-Hoveden, Katharina Hopp, Jared Tare, Dr. Terry Watnick, Scott Howe, Marine Corps retired, Van Stewart, United States Navy, Reed Novotny, Colonel, Maryland Air National Guard. Alex and Leslie, Chip and Kristen, Greg and Molly from Denver, William Tuttle, United States Navy. After my son's birth and diagnosis, I was diagnosed with tuberculosis sclerosis complex at the age of 43, just 3 months after I retired from the 23-year naval career. The complexity of this disease means that it remains to be seen whether my young son will be able to live the typical life that I have been fortunate to live. Because of research conducted through the TSCRP, my son has effective treatment options available to him that were not even just a decade ago. But there's still so much to learn. Again, another person benefiting from our research, benefiting from the funding that's now being threatened and cut. Beth Heinlein from Nevada, Shelley Mitzner, Reed Hoffman, David Brooks Carpenter, a military family, Major David Long, United States Air Force, Deborah Moritz, Fran Heiler. I just want to say that the Declaration of Independence clearly states, we hold these truths to be self-evident, that all men are created equal, that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. How can you have life, liberty, and the pursuit of happiness without health? Health is at the core of life. Health is at the core of true liberty. Health is at the core of the pursuit of happiness. The right to health is fundamental for overall well-being and for the realization of other human rights. In his annual State of the Union address to Congress on January 6, 1941, President Franklin Delano Roosevelt underscored the importance and shared commitment to 4 freedoms. Many of you know them. The first freedom is freedom of speech and expression. The second is the freedom of every person to worship their own way. The third is the freedom from want, which means every person deserves peace and health, among other things, he said. The fourth freedom is a freedom from fear, which in our country of great wealth, no one should fear their health care going away. We have known from our country's beginnings and throughout that we must do all we can to provide for our people, and we have tried to do that over the years, from Social Security Act of 65, which created Medicaid and Medicare, the Health Insurance Portability and Accountability Act of 1996, HIPAA, to the Patient Protection and Affordable Care Act of 2010, the ACA. We should be adding to these protections and benefits, trying to get more people health coverage. We should be caring for each other. We should be loving each other. We should be fighting for the justice of each other. We should be hearing the cries of parents worried for their children. We should be hearing the agony of a partner whose spouse has Alzheimer's. We should be standing up for these folks. This is why we fight. This is why I stand. Yes, I'll yield for a question while retaining the floor.
Senator Booker, first of all, I want to express my gratitude to you for recognizing the gravity of this moment. Your ability to see that we are facing a series of threats that are not normal, a series of threats to families, to children, to individuals, threats to our democracy, threats to our rule of law. I think it's really important. And you have endeavored to do something extraordinary here, to stand on your feet for as long as you can, to convey both to our colleagues and to the public that because these are not normal times, what is required of us is something different than a normal response. And I know maybe we have extended the amount of time that you had planned to talk on this particular topic of the threat to Americans' health care, but I don't know that there's anything more important than that we're talking about today in the United States Senate, because the scope of what Republicans are talking about here is absolutely extraordinary. And I want to lay out for you, a few additional facts and numbers and ask you to respond to them as you wrap up your time talking about this particular topic. But let me just underscore what you have laid out very well. We are talking about nearly $900 billion worth of cuts to Medicaid in order to pay for about $1 trillion worth of tax cuts for the wealthiest 1% of Americans. There will be table scraps in the Republican bill for middle-class consumers and families, but the bulk of the tax cuts are going to the very, very wealthy, millionaires and billionaires, frankly, people who have done tremendously well in this country over the past several decades, who are not in need of more. And so you were very right to point out the immorality of the 2017 attempt to cut the Affordable Care Act, which insured 20 million Americans. But Medicaid covers 70 to 80 million Americans. And the new wrinkle is that this proposal doesn't just cut health care for tens of millions of Americans. Estimates are that it could be 30 million Americans that lose health care under the Republican proposal. No, this is even more difficult to swallow for the American public than the 2017 attempt to cut and eliminate the Affordable Care Act, because this measure is a direct transfer of money from the poor and the middle class, the people who are on Medicaid, to the very, very wealthy. Frankly, it could turn out to be the biggest transfer of wealth in the history of the country from the poor and the middle class to the wealthy. Which is why I think you are taking this extraordinary step to make sure that our colleagues and the American people know the gravity of this moment. A lot of Republicans all across the country are not doing town halls any longer. They are not meeting in person with their constituents. And so there's a lot of Americans that are going to be in the dark, that have a lot of questions about what's happening here, about why it is necessary to cut a program like Medicaid that insures 24% of Americans to the bone in order to finance a tax cut for the very, very wealthy. One of the things I just wanted to set up for you here is, just to note that Americans may be surprised to know that 24% of Americans are actually on Medicaid today, because some Americans may say, well, my insurance isn't Medicaid. My insurance is through Mississippi Can, or my insurance is through Access Nebraska, or my insurance is through Centennial Care, or in Connecticut, my insurance is through Husky Health. In New Jersey, it's New Jersey Family Care, right? So Medicaid normally isn't called Medicaid. It's called something different in every state. And so it's important for you to understand that so many of your neighbors are on Medicaid, even though it may not be called Medicaid in your state. That's how we get to 24% of American families on this particular program. And the Joint Economic Committee, which is a committee of Congress, did a study, issued a report talking about how many people would lose their health care insurance on a state-by-state basis if this $880 billion cut to Medicaid went through. And I won't go through the whole list, Senator Booker, but I just pulled out some states that are represented by our Republican colleagues. In Alabama, 20% of Alabamans are on their Medicaid program. And in total, 330,000 people in one state, Alabama, would lose their health care if this cut went through. In Arkansas, 25% of families are on the Arkansas Medicaid program. 250,000 people would lose their health insurance. In Florida, 17% of the state is on Medicaid. 1.3 million Floridians could lose their health care because of these Medicaid cuts. We can just go on and on. 20% of Iowans are on the Medicaid program, 20% of Indiana residents, 25% of Kentucky residents, 30% of Louisianans are on their state's Medicaid program. 500,000 residents of Louisiana could lose their health care. Some of that would happen in a sort of slow-moving catastrophe, but as you pointed out, Senator Booker, a lot of that would happen immediately, because many of the states that have taken advantage of the Affordable Care Act Medicaid expansion have a built-in clause to their state's law that says the minute the reimbursement rate declines, even if it declines by only a few percentage points, the entirety of the Medicaid expansion program is eliminated. So overnight, you will have millions of people who will lose their health care insurance. But as you have rightly pointed out, that's just the beginning of the disaster. Because there are hundreds of rural hospitals in this country that are right now living on the brink of disaster. If Medicaid reimbursements drop just by 5 or 10%, those rural hospitals are out of business. Same can be said of thousands of drug treatment centers in this country, addiction treatment centers. And so you're ultimately talking about hundreds, if not thousands, of hospitals and health centers closing, millions of Americans losing their health care insurance. And for what? And for what? To be able to hoard a bunch of money so that the richest Americans can buy a third vacation home? So that millionaires can double their landscaping budget? Who's asking for this in America today? Of course there's a conversation to be had about efficiency in our healthcare programs, but none of that conversation is happening here. If it was, you wouldn't be reading the letters of all of these associations representing healthcare groups predicting disaster. They would actually be in the room at the table, because if you really wanted to save money, you'd actually put the doctors and the hospitals and the medical providers who know something about the system in a room. But instead, this is a political decision that's been made to cut a certain amount of money that does not coincidentally line up to the amount of money that the Republican budget bill wants to give in tax cuts to the very, very wealthy. And so you, I think, rightly put emphasis and drew attention to John McCain's decision. And of course, we should always give credit to Lisa Murkowski and Susan Collins, who also voted no in 2017 on the repeal of the Affordable Care Act bill, because it's just a reminder that you are under no obligation as a United States senator to do the wrong thing if you know what the right thing is. You work so hard to get this job, spend your entire life working to become somebody who can make important decisions like we can in the United States Senate. And you are under no obligation to outsource your decision-making to the President of the United States or your party leadership. Everybody here gets to make an independent decision on what's right or wrong. And this just feels plain wrong. A thoughtless, unplanned, massive cut in Medicaid that's going to throw millions of people off their health care in order to finance a tax cut, the majority of which is going to go to people who don't need it. Every senator here can make up their own mind as to whether that is the right thing or the wrong thing to do for this country. And the exercise that you are engaged in, Senator Booker, is a simple one, just trying to make sure that all the facts are on the table. That last segment you did on the impact on medical research should be reason alone for folks to reconsider the path this administration is taking. But the Medicaid cuts as a mechanism to further enrich those that are already plenty rich, man, I just don't imagine that is anything that the American public are clamoring for. And so, Senator Booker, I just wanted to really thank you for standing up and making this moment possible. And I want to leave you with just two stories on this topic that have come into my office, and then ask you a question. This is all a lead up to a question. So I have a constituent who was paralyzed about a decade ago, and he now exists in a wheelchair, and the only insurance program that can provide him with what he needs from a mechanical and technological standpoint, plus the drugs he needs to survive, is Medicaid. It's his only option. It's his only option. He can't work. He's paralyzed. Medicaid is his only option. And for him and for millions of others, Medicaid is life or death. It's just life or death. If you're talking about cutting Medicaid by as much as 20%, that's what we're talking about here today. An $880 billion cut to Medicaid represents about 10% of the overall program. But you have to assume that states are not going to continue to match if the federal government isn't putting in their share. So that 10% cut could very quickly become something closer to a 20% cut. There's no way that you can cut the Medicaid program by 20% without it impacting people like my constituent in a wheelchair who comes to many of my events when we protest these Medicaid cuts. This is life or death for many Americans. But that's not the full extent of the horror that will happen. I was just reading a letter the other day from an 80-year-old constituent of mine who lives at home with his wife, but his wife is very frail, and it is Medicaid and Connecticut's Medicaid waiver that allows for her to receive in-home health care services. And he is panicked. He wants to spend the final years of his life with his wife. And he knows that if Medicaid gets cut, even on the margins, that Medicaid waiver likely is gone. And either his wife will pass or she will have to be in an institution. Query whether that institution will be able to even give her a place, because 2/3 of nursing home beds in this country are paid for by Medicaid. And so one way or the other, he is staring separation from his wife in the eye. She either doesn't make it without the Medicaid reimbursement that gives her the services at home, or she is forced to go to an institution and they live separately for their final days. This is the reality facing people who rely on Medicaid, whether you are disabled or elderly. This is the reality that will be imposed on millions of Americans in order to finance a tax cut for the wealthy. The scope of this is just enormous, Senator Booker. And so I guess this is the question I wanted to ask you. You and I have been in government for a long time. We've served in a variety of different capacities. I don't think this country is really ready for the scope of the healthcare cataclysm that could come with a $1 trillion cut to the health insurance program that is responsible for the care of 1/4 of Americans, 2/3 of nursing home beds, and the budgets of literally tens of thousands of vital healthcare institutions in this country. And so nobody is better than you at conveying the moral consequences of the decisions we make here. Just share with us for a minute as you sort of wrap up a conversation on this topic of the health care priorities of the Trump administration and the Republican Congress, what America may look like in a world where we have decided to gut the program, the health insurance program of last resort for the most vulnerable Americans, and the health insurance program that insures 24% of Americans, 2/3 of which are working for a living. Just give us a little bit of a sense of the enormity of the consequence that this ultimately would bring to this country.
So first of all, thank you for the question, but I just want to reiterate the friendship I have with Chris Murphy and his willingness to spend the night with me here on the floor as we go hour after hour after hour. And I just want to say this again, and I'm going to say it a few times in this long speech that will go on for as long as I'm physically able. Chris, the last time we spent 15 hours on this floor together was a health issue. It was yet another stunning mass shooting, this time at the Pulse nightclub. And you and I talked a lot before we got on this floor. And I think the agony that you and I were feeling was, how can this be the strongest nation on the world who organized government? If you read our founding documents, if you read our founding fathers, one of the first things they organize this government for, it's good to carry around the Constitution. it is so important to understand what the preamble to the Constitution says we are about. We, the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our prosperity. Do ordain and establish the Constitution of the United States, which each one of us in this body went down there and swore an oath to uphold. Those are the first words of this, Chris. And God, I remember your agony. Folks, I want you to know, when I came to this body, my staff was talking about the maiden speech. Please don't go look back and look at my maiden speech. It was not great. But the maiden speech my staff wanted me to watch was yours. And it was gut-wrenching about Newtown. Gut-wrenching that the strongest nation on the planet Earth should now be this nation where we tell our children in this implicit lesson, not explicit, but implicit lesson, we are going to teach you how to hide. We're going to run actor-shooter drills because we can't protect you. And my mom lives in Vegas, and that Vegas shooting at a synagogue in Pittsburgh. And so here we were in yet another of these maddening realities in our country, that the leading cause of death for our children is shooting. And in our conversations leading up to it, I still remember you and I saying, we need to come to this floor. And you said, I'm going to stand and do something different. And we, again, just like tonight, we had no end to that. We were 9 years younger, my friend. And we said we were going to stand down here and try to get this body to do something different, to try to get this body to recognize the gravity of what was going on in the strongest nation on the earth that was having child after child after child, American after American, dying to gun violence. And the response we were getting from this body, the world's most deliberative body, was nothing's going to change. We can't do anything. I mean, I'm going to give you respect. Years later, you were part of the first gun legislation to pass out of this body in 30-something years. And now, I just found out that the community violence intervention money that you allowed me to fight so hard to get into that bill is being clawed back by Donald Trump. Our bipartisan bill, our bipartisan approved finances, money, and I think a taking away of our power in this body from the bill that you were one of the main architects of, with Republican colleagues, God bless them, people like Cornyn and others. And so I just want to take people back to what the insider conversations, and you were generous. I want to remind you, just teasingly on the floor, you never asked me if you could publish my text messages, but you put them in your book. It's a great book. I actually learned, I read lots of my colleagues' book. I learned a lot of data about gun violence from your book. And we were talking about this belief that these words, this belief in our country that these words, why this government was formed, is so important. America, this is who we are, these imperfect geniuses. We formed this, we the people, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty. And so you stood right down there for 15 hours. I paced this room, pledging to you that I wouldn't go to the bathroom, I wouldn't sit down, and I was hurting after 15 hours. But you were steadfast until we finally got Mitch McConnell to give us something. Was it 1 or 2 votes? it was 2 votes, and both of them failed. We didn't get 60, but at least we forced this institution to confront the horrendous horrors of that nightclub shooting. And so you ask me now, as you and I and my dear brother, who I've known since he was coming out of college, the 3 of us on this floor at A new day, it's past midnight. A new month, it's past midnight. As we sit here, why? Because of your question. I can't stand anymore to live in a country where it seems that the convulsions come that threaten our most vulnerable over and over again. I can't stand it. I have to stand up. I have to speak up. We have to do something different yet again. You and I talked about this last week. America, we are not doing a good job right now. We read the section about medical debt. Tens of millions of Americans are saddled with medical debt. 66% of the people that declare bankruptcy is because they can't afford their medical bills, because something that happened to them could happen to us and our families. My mother, my brother, and I have a lot of challenges, a lot of problems, but we weren't saddled with a rare disease. We didn't have tumors springing up all over our bodies. I don't know what that would have done to my family.
The gentleman yields.
Yes.
There is so much similarity between the debate that you are forcing this Senate to have tonight and the debate that we were having back in 2016 on this epidemic of gun violence. I always describe it this way. The only thing that matters, the thing that matters more than anything else in your life, is protecting your loved ones from physical harm,
yes.
right? You would give anything, right? Anything. You would give your life saving, your house. You would perhaps give your own life in order to protect your child or your brother or sister or mother or father from physical harm. And so when you and I have sat across from the victims of gun violence, many of which live in your neighborhood and my neighborhood in Newark and Hartford, we are looking at a kind of desperation and sorrow that is unique, that comes with not just losing a loved one to gun violence, but feeling powerless
Yes.
in that exercise, feeling like there was nothing you could do, and watching your elected leaders stand by and allow for this reality to continue to occur in your neighborhood where kids are being shot down in cold blood and your elected leaders, the adults in charge of your community, are standing idly by. That is not fundamentally different than the reality that will be visited upon millions of families if this size of a cut in Medicaid funding goes into effect, because families out there who rely on Medicaid to keep alive their son or daughter who has a complicated medical disease have no other quarter, have no other last resort besides Medicaid. And so Medicaid stands between life and death for their son or daughter. There is no other place for them to go. And so that same empty, hollow look that we have seen so many times in the eyes of a mother or father who lost a son or daughter to gun violence, that is the look that we are choosing to visit upon millions of families in this country who, when faced with the loss of their only health insurance option for their disabled child, will watch their child potentially face the same fate as those young men in your neighborhood and my neighborhood. And so that's the reason why I pose this question to you that you're answering about the moral gravity of this moment, because it is not fundamentally different,
right, and
than the one that brought us here in 2016.
And in answering this question, and again, I'm going to continue to yield a question to you while retaining the floor, I want to just compound this for people, because I know these numbers, 880 billion, 100 million Americans affected by, that would be affected directly by Medicaid cuts, or the people that work in the hospitals that would be affected by Medicaid cuts, or the nursing homes that are affected by Medicaid cuts. These are big, big numbers, but people, these are human beings. I live in a community that had a horrible lead poisoning problem for their kids, that had horrible toxic sites, and children born around toxic Superfund sites, as you know they're called, have higher rates of autism, higher rates of birth defects. And So even coming up as a city council person, I saw that the environmental injustices surrounding my community were causing parents to have to deal with medical complications amongst their children at alarming rates and needed help, and Medicaid was the program. No fault of their own, environmental injustice. Now here's the double insult of the Trump administration. One is they gutted the environmental justice section at the DOJ. They're not investigating corporate polluters. They're not investigating the injustices environmentally that big, powerful, wealthy people do, that often cause people, we all saw Aaron Brockovich, that cause people to get seriously hurt. And then the second part of that insult is, we're not only not gonna hold people accountable and let them get away with that, the polluters or what, the folks causing often the source of the disease, we're now not gonna help get health care to the families who often live in fragile communities that have these resources. These are the people, when you sit with them in your office, as you and I have, as me and the other senator from New Jersey on the floor tonight have, as you sit with them and they tell you their stories and you see that this is a lifeline, that this Medicaid program, and you were so good by telling people, because I saw this during the Affordable Care Act, just the name alone, people are like, I don't have Obamacare. Yes, you have the ACA, and let me explain it to you. It's under many different names, including in my state, that people don't know that this is a Medicaid-funded program, so they don't know that this is a sword of Damocles at their family's well-being. But this is the larger issue, Senator Murphy, is that these are real people in every county, in every state. It's why they're representatives. It's why I read statements demanding there not to be cuts by the organizations, bipartisanly read, the League of Cities, the largest mayor association, Republican governors, and others are all saying, do not cut this program. They're not even saying, don't do 880 million, maybe just do 400 million. They're saying, do not cut this program. And many of them are saying, in fact, we need to find ways to expand the program because there's still gaps that people are falling into. And it doesn't make economic sense, because if you get regular care, if your chronic disease is treated, it ultimately could be cheaper to the taxpayer as opposed to people ending up in hospitals. But those hospitals now, because of what's being threatened in this bill, rural hospitals and tier 1 trauma hospitals are all being threatened in their care. And so tonight, it's not normal. I ask everybody to understand, this is not a normal moment in America. This is a crossroads moment in America. It's one of those times where the values that we talk about in the Constitution are at stake. What is going to define us? Our commitments to ideals of justice, fairness, of being there for each other. And one of those other programs that is now in crisis is what I want to switch to. And I think my colleague was joking with me, because we have, for anybody who's watching, we have a whole list of things we wanted to get to, and my staff now seemingly very ambitiously, Medicaid, Medicare, healthcare, Social Security is coming up now, tariffs and economic policy, education, national security, public safety, immigration, housing, chapter by chapter, each one about an hour or so. This would be enough to make it till tomorrow evening if I can stand that long, and who knows. But we're behind schedule, so I'm going to jump into talk about Social Security. And I want to start because, as I said earlier, I get to stand here, I get to come on this floor, but so many millions of people don't, and I want to elevate their voices tonight, because as I go across New Jersey, as I go across my nation, I see Republicans, Democrats, independents, veterans, so many people stopping me in airports, stopping me in the community, stopping me in the grocery store, wanting to tell me that they're afraid, that they're angry, that they're worried, that they believe we are in crisis, that our nation is at a crossroads. Who are we going to be as a nation? And this topic, I don't know if maybe I will just let you all know that this topic, my mom chewed into me about this topic. She lives in a senior citizen retirement community, mostly Republican. I visited her many times. It's a great community. I hate how we go to this idea of right or left. These are great seniors that live in a great community, and they're talking about Social Security. So I want to start before this section by just reading. This is how people are sending it to me. This is a small postcard, handwritten, from somebody from Hamilton Square, New Jersey. Dear Senator Booker, I'm writing to ask you if my Social Security is now in danger. Please let me know. It is very important to me. Thank you. I'm going to try to answer that tonight fairly and candidly. Here's another person who writes, my staff is protecting their identity. I just want to say where they're from, South Plains, New Jersey. I am one of your constituents and a proud New Jersey, and I'm writing to let you know how upset, distraught, and worried I am about the current state of our country. I hope you will take time and read my letter, as this is the first time I have felt compelled to write a government official. I want to tell you, I'm reading your letter again, and I'm now reading it on national TV. If C-SPAN can be, presiding officer might challenge me with a factual error, but C-SPAN is national TV, I think. I want to start by telling you a little about myself. I am 64 years old, and I am currently working full-time. I am a breast cancer survivor. My plan was to retire in the next 3 years, but with the current state of chaos and turmoil, I honestly don't see how I can retire. I'm concerned about Medicare, which I will definitely need when I retire. I will also need a supplemental plan for whatever Medicare does not cover. I do not qualify for retirement benefits through my job. With the cuts being made to federal programs, Medicare will not be enough. I would need a more expensive supplemental plan to cover these cuts. I am also concerned about Social Security. I have worked since I was 16, except for 9 years when I was home with my 3 children. I have worked hard and paid into Social Security and believed that the money was for my retirement. Now I hear that Social Security is a Ponzi scheme, and it may be privatized. This is so unfair for people like me that worked hard all their life and counted on this money to retire. I was planning on working past 65 to get my full Social Security benefits, but now I begin to wonder if it's worth it. Now I begin to wonder if it's worth it. So at this point, I'm in a holding pattern due to the unstable climate in which we are all living. As I said, I have 3 children who are all adults now. My son has been diagnosed as being bipolar. He's been hospitalized a few times due to this. He is currently on medication that he needs to function and sees a therapist. He is in grad school and is on Medicaid. He works part-time since he is a full-time grad student, so he does not qualify for benefits. I worry about what these cuts will do to my son and others like him. No one seems concerned with the people who rely on these programs to live their best life. Someone needs to look out and take an interest in helping people in these circumstances. My daughter is a teacher in a district that receives Title I funds. She works very hard as a teacher and is devoted to her students. With the supposed dismantling of the Department of Education, I'm concerned about what this means to the education field, teachers, administration, and students. My daughter's school is making a difference in the lives of these students, and they need the funding that is received from both the state and federal government. Programs like the Title I and other federally funded programs need to stay in place. On another